Good evening, everyone. We're going to give it a couple more minutes for people to continue to join. So we will get started right around 6:03. Just going to give people more time to join. But if you will go ahead, there's going to be a poll that's popping up on your screen in just a minute. If you'll go ahead and answer that while you wait, we will get started in a few minutes. Thank you so much. Hey, everyone. Thank you all so much for joining us. We're going to give it a couple more minutes. We'll start around 6:03. Everyone's been muted, but if you'll go ahead and answer that poll that's on your screen while you wait, we will get started very soon. All right, we are going to go ahead and get started. Good evening, everyone. My name is Marianne Matheson, and I work for Medtronic. Tonight, I have the pleasure of hosting this webinar where you're going to get to hear from Dr. Kaplan with Georgia Urology. Dr. Kaplan received his undergraduate degree in biology from Washington University in St. Louis, Missouri. He graduated from Emory University School of Medicine and then completed his general surgery internship at the New York Hospital Cornell Medical Center and completed his residency in urology at Georgetown University Medical Center in Washington, D.C. Tonight, he is going to be speaking on overactive bladder, urinary retention, and fecal incontinence or stool leakage, as well as a therapy called InterStim that helps to treat those. As I mentioned earlier, I work for Medtronic, and that is the company that developed. Not know the name Medtronic. You probably do know someone who's had a pacemaker, and that is what we are best known for. So I'm going to pass the mic to Dr. Kaplan in just a moment so that you can hear more about this. But before I do, I want to make a couple of reminders. Everyone has been muted upon entry. So if you have a question, please go ahead and into the Q&A portion on the bottom of your screen. We are going to answer all of those at the end, and all of your names will remain anonymous. Like I said, please type any questions you have in the Q&A. That chat function has been disabled for this to protect your privacy. And then there's an anonymous poll on your screen. So if you will go ahead and fill that out right now. Without further ado, we're going to go ahead and welcome Dr. Kaplan.
All right. Thank you. Thank you. I'd like to welcome everyone tonight for listening to this webinar. We're going to be talking about some treatment options for, as Mary said, for some bowel and bladder control problems, as well as for urinary retention if you're not emptying your bladder out well. Let's go into it right away. These are just some statements that can that people say when they're having these kind of issues, when you're having really urinary leakage, or even stool leakage. When you have such an urge, you can't hold either of them. You're afraid to leave home. It's embarrassing. And a lot of people are just afraid to ask for help, but there are options out there, and that's what we're going to talk about tonight. So first, we'll talk a little bit about what the overactive bladder is. So overactive bladder is basically urinating more than 8 times a day or getting up more than twice at night. Um, we don't exactly know the exact cause of it, but the bottom line is when your bladder starts to fill up, it doesn't like to hold the urine like it used to, and you got to go to the bathroom. And sometimes it's such a strong urge you can actually leak urine. The bowel portion is sort of similar, and it actually probably occurs more after eating. That sometimes can trigger it. You get an urge to go to defecate, and sometimes you can't make it. Also, sometimes it just will happen on its own. So those are both similar, and the reason for that is the nerves to both the bowel and the bladder originate from the same source. So what happens if when you're ignoring this problem, causes, like we said before, a loss of self-esteem, self-confidence, but you're not alone. About 1 in 6 adults in the United States are affected by bladder control problems, and about 1 in 12 are affected by bowel problems. So the good news, we have treatments available for these conditions, and that's what we're going to discuss now. And I already talked a little bit about this, what causes the bowel and the bladder problems. A lot of times it's what you're eating and drinking. Certain foods can make you have to urinate more often, and certain foods will, based on your diet, will make you have to defecate more often. And a lot of times you just sort of have to figure out what that is, and you can also adjust your diet to help control that a little bit. So let's first talk about the bladder. How does it work when you urinate? Well, your bladder fills up, and there's a reflex between the bladder and the spinal cord. And once it gets to a certain level, your bladder wants to automatically contract and empty your bladder out. So that's what happens in babies. Their bladders fill, they urinate into the diaper. But when you become older, you able to overcome this and control that urge. And that's what the brain does. So the brain will send a signal down to the bladder, and it will stop that urge to urinate and keeps you from having an accident. Well, as you get older, and for other many reasons we don't always know, there's a disconnect there, and you can have urge incontinence, and you just can't hold it, and then you'll leak. So that's what happens. The bowel, similar situation. There's a reflex again from the pelvic nerves when stool gets into the sigmoid colon, and your brain should be able to override it by controlling the sphincter and keep you from having an accident. But once again, when there's issues with that connection from the brain down to the rectum, you can have an accident. So back to the bladder stuff. So what are the different types of bladder issues? There's stress incontinence. There's urinary retention, which is basically not urinating at all or not emptying your bladder out well. And there's overactive bladder. So let's first talk a little bit about stress incontinence. Stress incontinence is leakage when you cough, sneeze, laugh, doing heavy lifting. And when you leak from stress incontinence, typically it's a small amount of urine. And what happens is the pressure, whatever you're doing, is greater than the pressure that the urethra can tolerate, and you leak a little bit. Urinary retention is when either you can't urinate at all or your bladder muscle has become weak and you don't completely empty. When you don't completely empty, the problem is you don't really know you're not emptying all the way. You may feel like you're emptying, but you're actually not. So, and then overactive bladder. So like I said before, overactive bladder, the definition is going more than 8 times during the day or getting up at least twice at night. And again, it's a neuromuscular problem with the bladder. It doesn't like to hold the urine, and then you have to go more often. It's typically small amounts of urine that you're voiding. And then, like I said, it's fecal incontinence, similar thing. A lot of times it has to do with the gastrocolic reflex. You get such a strong urge to go, you can't hold it, and you'll have an involuntary loss of stool or some seepage. So what are ways to control these problems? Well, there's lifestyle changes, like figuring out what foods are triggering it. You can cut back on those. Caffeine can cause more overactive bladder symptoms, spicy foods sometimes. And then when it comes to the fecal incontinence, you have to figure out what foods. Maybe it's fatty foods, maybe it's you're lactose intolerant. They're just different things. And you have to try that. And if that doesn't work, you go into oral medications and then finally to advanced therapies to help the problem. Like I said, lifestyle changes would be diet control. There's biofeedback, physical therapy, which includes Kegel exercises to strengthen the sphincter muscles. So what are the oral medications? So the oral medications for the bladder are typically called anticholinergic medications, and those are the similar medications that work for the bowel also. And what they do, they're basically just a muscle relaxant for smooth muscle. The problem with most of the first generation ones, they cause a lot of side effects, which includes dry mouth. It can cause blurry vision, constipation, sometimes high blood pressure. The second generation medications do have lesser side effects, but you have to take the medication every day for it to be effective. And that's what this slide goes on to talk about. Most patients who start on this medication, either they can't tolerate the pills because of the side effects, or they just get tired of taking the medication. And so 82% of the time, which is probably about it right, most patients will end up stopping their medications by 12 months. So what are other options we have available rather than having to take a pill? And one of the options we have for bladder and bowel is a treatment called InterStim. And InterStim is a sacral neuromodulation. It's basically a nerve stimulator to help relax the bladder, help relax the bowel, and give you better control. One of the other options we also have, and it mentions over here for bladder control, is injected medications, and that's Botox, which is a temporary fix also. Botox is similar to what you use for cosmetic. You inject into the bladder muscle. It's a muscle relaxant. It can last up to 6 or 12 months, and then it has to be repeated. Medtronic Neurosystem, the second one, is a peripheral nerve stimulator, sort of like acupuncture, a tiny little needle that's placed near your ankle, and it sends a small electrical impulse up the leg to the bladder. It's done once a week for 30 minutes and up to 12 treatments. And it does help some, but not nearly as effective as the actual InterStim device, which is more permanent. Like I said, Botox is a medication. It's a muscle relaxant that again lasts 6 to 12 months. And there's in this slide it says it doesn't address the bladder brain communication, which does not. It's basically just working on the muscle. It's not working on the nerve. So sacral neuromodulation. This is a relatively simple way, and it's been around for actually a long time, probably about 30 to 35 years now, to help control bladder and bowel function. And in this slide over here, it shows the generators, and there's a rechargeable one and there's a non-rechargeable one. Both of them are equally effective, but obviously the rechargeable one has to be recharged periodically, and the non-rechargeable one with the latest batteries can last up to 15 years. So in my practice, most of my patients go for the non-rechargeable one because the battery lasts so long now. So how does this work? It's a two-step process to have sacral neuromodulation. The first step is a test, and what we do is you come into our surgery center. It's done while you're awake under local anesthesia. We place a small wire into the lower part of your back. You wear an external battery for a few days, and we monitor your symptoms with the rep from the company. And if we see improvement, then we would put in the permanent battery as a surgical procedure down the road. So the same thing is actually used for stool incontinence too. And again, that's because the nerve from the S3 foramen goes to both the rectum and to the bladder. So that's how it can improve both conditions. The satisfaction rate for these procedures is very high. For the bladder, it's approximately 84%, and actually, and for the fecal incontinence, it's up to 89% effective. So that's sort of it quickly in a nutshell. I went through that fairly quickly, but in my experience, the InterStim device, which is sometimes I call it a bladder pacemaker. We don't like to call it that, but it's really a nerve stimulator, which helps not only relax the bladder, it also can help actually urinary retention. There wasn't many slides on that, but the urinary retention component, we're not totally sure how it works, but by stimulating that nerve, if you're not emptying your bladder out, it will strengthen the bladder muscle, and patients will empty their bladders better when they have a weak bladder. So it does work for that condition too. So I think in that questions.
Yes, we will go ahead and start the questions. I'm going to make a quick announcement really quick about this QR code that's on your screen. Regarding appointments, that QR code right there is going to be the fastest way for you to get in and see Dr. Kaplan. If you would like to schedule an appointment with him, what you're going to do is open your phone or your compatible device, scan the QR code. A banner is going to pop up that will display, it's a little yellow scheduling banner. You'll click on that, and when you're prompted for the reason for your visit, you will want to type in webinar. You can also schedule an appointment by going to the website and clicking on the orange schedule button in the corner, and then typing in webinar again when you're prompted for the reason for your visit. So that is going to be the fastest way to make an appointment. And now we will go ahead and get to the questions. So we had someone ask, I'm on my second prescription, no real changes. I've been taking prescriptions for 2 years. Is this normal? Can I take natural supplements, and is a procedure possible?
Well, first, if the prescription's working for you, then I would say you have to stay on it. If you want to get off medication, which a lot of patients do, then it's time to, look at other options out there. And the third thing, now, I don't know if any natural supplements are going to help this kind of problem, mainly because it's really a neurologic type problem. There's no supplements that are going to work for that.
All right, we have another question. I have issues when I have the urge to go urinate. I leak while walking to the bathroom. Medications have been working to cut down on the frequency of urinating, but what else would you recommend?
Right. So you're having urge incontinence. Like, again, your bladder doesn't like to hold the urine. You get the urge, you can't make it. So obviously you're in what we call the second line therapy right now, which is medication. And if that's not working well enough, then it's time to move on to the third line therapies, which again would be something like Botox or peripheral nerve stimulation or the sacral neuromodulation. So that's what I'd recommend, that those are the three options.
All right, we have another question right here. How many medications do I have to try, and for how long until I can move on to one of the more advanced therapies?
So typically you have to try and fail 2 different medications before you can move on. And that's not that we wouldn't have you start out with the advanced therapies. It's just required by the insurance companies to get approval. Usually it's probably about a 3-month process by the time you try 2 different medications.
All right. Someone said, I have done a 12-week session with PTNS. I have seen some relief and was able to get off one of my 2 medications. Like I said, I have had some relief, but I'm still not where I want to be. What would you recommend?
So I think that's the way I look at PTNS. It's sort of like it's a good trial for the more advanced sacral neuromodulation, which would be InterStim. So if you're getting some success from that, I think you'd get a much greater benefit with InterStim, which is actually the implant, the generator that goes in your lower back.
All right. Someone was asking, they said they have an enlarged prostate. They're not experiencing bladder leakage though, but they are finding themselves getting up once at night. They're taking 2 different medications. Do you feel like there's another option for them?
Yeah, so in men, it gets a little bit more complicated because you do have our prostate when it comes to urgency and frequency. And so it requires a little bit more of a workup for a guy. We have to obviously rule out that the prostate's not the source of the symptoms. So usually in men, they require a cystoscopy also in the evaluation to make sure there's not an obstruction. But assuming, let's say there was no obstruction, your prostate was open, and it was mainly a bladder problem, then you couldn't move on to more advanced therapies like InterStim.
right, we have another question. How many have you done for the InterStim, and how successful do you feel like your patients have been?
So I've been doing InterStim since I was a resident. That was back in the first one was probably in 1998. So it's been a long time. So Medtronic was the first company to develop the sacral neuromodulation. So we've been doing it for years and years. And I do in the practice, I probably do, several dozen a year. Um, and my success rate is probably pretty close to what they report. I'd say it's around 85%. That's probably about accurate. The good thing about InterStim is once it's in place and then it's programmed properly, you don't have to do anything. You don't have to mess with it. You just leave it on. And that's the beauty of it. That's why it's better than PTNS, because PTNS, you're only delivering the impulses during the session versus a permanent generator that's in your lower back. It's always sending the electrical impulses to the nerves. It's continuously working 24/7.
And then they asked about insurance approval too. Is this something insurance covers?
Oh, well, you could probably answer that too, Mary. But yeah, yeah, you have to go through a few hoops sometimes, but for the most part, yes, it does cover it.
All right. We have another question. How did you know it was the right time to try a new treatment option?
So we have an algorithm, or we call it a pathway. Most urology groups have that. When there's a pathway we have for overactive bladder or urgent continence, and it's a stepwise process. Like I said, the first step is usually trying to adjust your diet, fluid intake, physical therapy, biofeedback, and then we go into medications. And if that's not working anymore, then we move on to the more advanced treatments. And it's just a pathway that we follow.
All right. Someone asked, how big of a quality of life change is this typically for your patients?
I would say the ones I've done, it's 100% better. They're happy. It works. They're not getting up all the time. They're not going all the time. They don't have to take medication anymore. The InterStim is, the latest models now, they're MRI safe. You don't have to worry about that. You can still get MRIs. Back in the early days, you couldn't do that. So if you're going to require MRIs, we couldn't put an InterStim in, but that's all been resolved now, and that's not an issue. So yeah, I'd say it's very high.
All right. And then one more. So far, this is our last one. So if anyone has any more, please go ahead and type them in. What is the surgery and the recovery like for InterStim?
It's not too bad at all. The surgery for the second stage portion where you put the generator, the battery in, the surgery probably takes 30 minutes. It's done under local anesthesia with twilight, some sedation. There's a incision in your either your upper left buttock or your upper right. It's probably only about maybe 2 inches. And then you'll have a tiny little incision in the middle of the back where the wire had to go in. Everything's internal. You can't see any of it. The wire's tunneled under the skin to the battery. The recovery's probably, the incisions are healed completely in 2 weeks. You can go back to normal activities. They're probably just in a couple days. It's just a little bit sore on your upper buttock. That's it.
All right. One more person said they have an appointment at your office next month in Town Lake, but said they only saw you once. They've seen another practitioner 3 times. How would I see him for follow-up with one of these treatment options? To elaborate more on that, that is the QR code right there. So if you scan that QR code,
You
that
just
will
scan
take
the
you.
QR code and just ask for me, and they'll take care of it.
Yep. And then put webinar in when you're prompted for the reason for your visit. That should take care of that. So I think as of right now, that is all the questions that we have. If you have any more, please go ahead and type them in, but we're going to start wrapping things up. So thank you so much, Dr. Kaplan, for your time and for doing this. We're so appreciative. Everyone, that QR code is still on the screen. So if you want to scan it to make an appointment, just go ahead and do so now. You will scan that. And then, like we've said 100 times at this point, type webinar in when you're prompted for the reason for your
Mary,
visit.
were there any questions that they didn't answer that you can think of that they forgot that we need to talk about?
That we should go over? I think
Yeah.
really, I feel like you hit all the high points of this. I think largely for patients to know, well, we have a couple more actually. So someone said, what about when the permanent battery fails at 15 years?
Well, so that's a good question. So it has to be replaced. It's just like a pacemaker. we know in advance, but there's a way we can measure the battery life that's on the programmer. The programmer looks sort of like a little cell phone, and it tells us how much battery life is left. So we'll know in advance. And then we just schedule the procedure. We go in there, and all we have to do is we do have to make another incision where the battery was. We take that one out, and we just put a new battery in. We don't have to replace the lead. It still works fine. So we just plug it back in, and that's it.
And we have had someone put in here they need to be followed up with, so we'll send all these along. And then another person that does have the implant. The nice thing about this therapy is that there are several different options for programming. So we will follow up with you on that as well, because we can always make adjustments to the device once it's implanted. So that's a really great benefit to this. We had someone ask, are IC patients a candidate for this?
That's a good question. So is it indicated for IC? No, I guess it's more of an off label, but we've had patients, use it, especially if you have IC and overactive bladder. Is it going to control, the pain from IC? That's, I can't answer that. It may help, it may not.
All right. Another one. Cysto that you mentioned. How painful is there local anesthesia, and is there a recovery period?
For the
The
cystoscopy,
cystoscopy.
that's done under, that's totally under local. It takes about not more than 2 minutes. It's done with lidocaine jelly, but we also offer, you can do it. We can add laughing gas to that too, if it helps relax you a little bit. And there's really no recovery. You may have a little bit of burning the first time you urinate after the procedure, and that's it.
All right. Someone asked if this could be used if the bladder sling surgery did not work.
Okay, so the bladder sling surgery is for stress incontinence, so it's not going to help the stress incontinence. That's a good question. So if you're still having stress incontinence, it's not going to help that. Some patients who've had bladder slings many, many years later, it turned out the sling was a little too tight, and now it's caused some bladder muscle dysfunction, and it may help in those patients, but you have to get, again, a workup. You have to do a urodynamics test on patients who've had a sling to see exactly what's going on with the bladder. Is it the bladder, or is it the sling, or what? So it's possible. That's all I can tell you.
All right. What is looking like, well, every time I say that. So we have all of these questions right here on a report. So we will follow up with everyone that's asked questions if we need additional follow-up in that regard. But we really are so grateful for your time, Dr. Kaplan. Thank you for doing
Thank you.
this.
Thanks, guys.
Much of what we discussed tonight is really relevant to so many of you. But every person is unique. So it's always really beneficial to make an appointment where you can really individually discuss your symptoms and your problems. So just make sure you fill out that survey. We will follow up with everyone following this event. And thank you again for your time.
All right. Thank you.